An Indian origin former CFO of a US medical device company is going to prison after admitting his role in a scheme that paid doctors to use the company's products. Basically, a bribe. Aditya Humad, 41, a former chief financial officer of SpineFrontier Inc., has been sentenced to 4 months in federal prison, followed by 1 year of supervised release. He was also ordered to pay around $9,500 in fine. But that's not all. The bigger story is what happened behind those payments. According to the US prosecutors, Humad was involved in a scheme that directed more than $540,000 in payments. And these payments were directed to surgeons through what prosecutors describe as a fake consulting agreement. On paper, the doctors were being able to pay for the consulting work and technical feedback on the SpineFrontier spinal products. But prosecutors said that much of that work was neither not performed or was far less than the numbers of hours reported. And for the real purpose, authorities alleged that they encouraged surgeons to use SpineFrontier's medical devices during the surgeries. And that matters because some of these procedures was paid by the US government healthcare programs, including the Medicare, the Medicaid, and the Veterans Health Administration. In other words, prosecutors said that the scheme was not simply about private business deals. It was potentially affected taxpayers-funded healthcare. Humad had previously pleaded guilty to conspiracy to violate the federal anti-kickback law. The case also involved SpineFrontier founder and CEO of Kingsley Chin. He was charged alongside Humad in 2021. The US authorities say that the company generated millions of dollars in revenue from surgeries involving doctors who received these payments. And this is where the cases become much bigger than just one executive. Federal officials say that they have recovered more than $4 million through the criminal and civil proceedings. And these proceedings involve the executives, the companies, and the doctors connected to this case. Well, the message from the US authorities is clear. Paying doctors to influence medical decisions can trigger serious federal actions, even if the payments are disguised as legitimate consulting fees. For Indian origin professionals working in the US healthcare and the corporate sector, this is an important lesson here. Senior positions come with enormous responsibilities, and regulators can look beyond the paperwork to determine what payments were actually designed to achieve. Now, Humad's prison sentence may be only for 4 months, but the consequences of the scheme have lasted years. And the US government says that the investigation shows that the healthcare fraud will continue and will be pursued, no matter how sophisticated the arrangement was. What is your thought on this? Make sure to comment down below.